Brushing your teeth may seem like one of the simplest parts of your daily routine, but are you really doing it right? How often should you brush to keep your teeth healthy and strong? And what happens if you don't brush enough? Let's dive into the answers and learn why brushing frequency is more important than you might think. Your smile and your overall health could depend on it. Whether you're someone who brushes after every meal or you rush through it at night, this video is here to set the record straight. We'll cover everything from how often you should brush, why it matters, and how to tweak your routine for maximum oral health. So, how often should you brush your teeth each day? According to the American Dental Association, brushing twice a day is ideal. Once in the morning and once before bed. These two sessions help freshen your breath, remove food particles, and keep plaque from turning into tartar. The morning session gets rid of the plaque that builds up overnight, while the nighttime brush removes the food debris and bacteria that have accumulated during the day. Brushing twice daily strikes the perfect balance. If you brush less often, plaque can harden into tartar, which can lead to cavities and gum disease. But if you brush too aggressively or too frequently, you risk damaging the enamel, the protective layer of your teeth. Now what about kids? Developing good habits early is key. Start brushing as soon as that first tooth appears. For infants, use a soft toothbrush with a tiny smear of fluoride toothpaste. As they grow, you can use a pea-sized amount. Make brushing fun by turning it into a game. Play a 2-minute song or pick a toothbrush with their favorite character. These small touches can make a big difference in ensuring they stick to their routine. Brushing twice daily works for most people, but there are times when you may need to brush more often. For example, if you wear braces, food particles can get trapped, so brushing after meals is a must. Dry mouth can also mean more bacteria, making more frequent brushing necessary. And for individuals with certain oral health concerns like gum disease, your dentist may recommend more frequent brushing or special treatments. Now, what happens if you don't brush often enough? Skipping your routine may seem harmless at first, but it can lead to serious consequences. Plaque builds up, acids from bacteria attack your enamel, and over time, cavities and gum disease can develop. Left unchecked, this plaque can turn into tartar, which only a professional cleaning can remove. And gum disease is no small issue. Gingivitis, the first stage, can cause swollen, bleeding gums. If untreated, it can lead to periodontitis, a more severe condition that may even result in tooth loss. But the risks go beyond your mouth. Poor oral hygiene has been linked to heart disease, stroke, and even complications with diabetes. Oral bacteria can travel into your bloodstream, affecting your overall health. Now that you know why brushing is essential, let's talk about how to do it right. First, choose the right toothbrush. Soft bristled toothbrushes are gentle on your gums and enamel while effectively removing plaque. If you have braces or struggle with mobility, an electric toothbrush might be a good option. Make sure to replace your toothbrush or brush head every 3 to 4 months, or sooner if the bristles are worn out. Did you know brushing immediately after a meal isn't always the best idea? If you've eaten acidic foods like citrus or soda, wait about 30 minutes to an hour before brushing. The acid softens your enamel, and brushing too soon can cause damage. When you brush, use gentle circular motions and hold the brush at a 45-degree angle to your gums. Spend about 2 minutes covering all surfaces, front, back, and chewing areas. And don't forget your tongue. Cleaning your tongue can remove bacteria and keep your breath fresh. Brushing is just one part of the puzzle. To keep your smile bright, add flossing to your routine. Use 18 inches of floss, wrapping it around your fingers and gently sliding it between each tooth. This removes the plaque your toothbrush can't reach. Mouthwash can be a great finishing touch to your routine. After brushing and flossing, rinse for about 30 seconds with a recommended amount. Choose an alcohol-free formula if you have sensitive teeth or need extra help with things like bad breath or gum issues. Remember, your smile is worth the effort. A little care now can save you from painful dental issues in the future. At Direct Dental of Pico Rivera, we're here to guide you every step of the way with expert care. A brighter smile, healthier teeth, and better overall health are just a brushstroke away. Call us today at 562-949-0177 to book your appointment. Your best smile starts here.